Well, we did not try it because it was very, very large, and the patient had been submitted already to another attempt to resolve the problem in another hospital. He came with some hematuria and fever, so we tried immediately to an approach surgical that allow us to solve the problem, because this is not conventional approach. These are particular cases after failure of previous treatment. So many of our case series that we presented this Congress are complicated. Many of these patients came in emergency. So it is, the message is that we can also consider the laparoscopic approach. It's not the proposal for the first attempt, of course.
Question? Yes, I wanted to ask you about the second and third case. I understand that you have tried, but I assume that these stones are due to BPH. There's an obstruction under the bladder. How did you treat that?
I believe with you, bladder out obstruction must be removed because it's the responsible for the obstruction. But the first patient we discovered also an multisystemic atrophy, was an urologic subject. The second one came in emergency as a very bad hematuria. We tried the endoscopic approach and we failed, and he has been resolved BPH in a second time. And of course.
Why didn't you try to solve the BPH at the same time while removing the stones?
When we try by the endoscopic approach, we have a very bad hematuria, and so we will be confident in the first approach.
No, I was thinking laparoscopy or open.
Oh, yes, in that moment we were not confident. I agree, but it is possible, of course, by median approach. Thank you.
Congratulations for this wonderful educational video, no, for different and specific situations. In the first case, do you treat, or do you think in the possibility to treat by percutaneous approach?
I think it's feasible. We have seen in this Congress also combined approach, no? So we have learned something new, and also the video presented in this session contain a very important message, because combined approach may be proposed for treat this very, very large that with only percutaneous is not feasible.
Okay, thank you very much.
Thank you to you.
Next one, and urological treatment of calcium diversion.